Is it true that if you have chalky teeth, that tooth decay is inevitable? People use this term in two ways. One of them is correct and factual, and the other one makes my eyes roll. Chalky teeth is known as enamel hypoplasia. This refers to teeth that have a softer, more porous appearance. They can often have a white, chalky look, and this is caused by factors including genetics and nutritional deficiencies or environmental factors during tooth development that means the enamel actually doesn't form and grow properly. So it is weaker and it is thinner and it is not as strong and as durable as healthy enamel. Now, people who say, oh, I've just got chalky teeth and I got them from my parents and that's why I get loads of cavities, are using that term to be somewhat irresponsible about their oral care and their eating habits. Often the first indication of enamel hyperplasia is that there's a rough texture. The surface of the teeth may feel rough or uneven. There can be increased sensitivity to hot, cold or sweet foods, and this can be a sign of weakened enamel. Discoloration. In some cases, teeth may appear yellow, brown or even orangey due to the underlying dentine being more visible and due to the enamel having grown weird. It just can end up with these very kind of weird, patchy looking appearances. What are the causes of chalky teeth? Well, some of the most common causes include nutritional deficiencies. So lack of essential nutrients, particularly calcium and vitamin D, during childhood can affect your enamel development. Fluorosis. Now, this is why I'm not so keen on being exposed to fluoride. If you have overexposure to fluoride, by ingesting it in the water or in tablets or drops, this during early childhood can lead to fluorosis, which again, it deranges the way your enamel forms, and that can lead to chalky spots on the teeth and weaker enamel. Genetics. Some individuals may just be genetically predisposed. We don't know why, but it does sometimes run in families that there'll be more enamel hyperplasia in one family than there will be in another. But again, I think we've got to look at nutritional status and fluorosis as part of that equation. Now, there can be environmental factors. So if you had illnesses when you were a child, or you were on medications, or you had trauma to a tooth during its developmental stages, that can also cause chalky teeth. So let's address this myth that if you have chalky teeth, you're definitely going to get cavities. Now, while it is true that chalky teeth are more susceptible to decay, it doesn't necessarily mean that tooth decay is inevitable. With proper dental care, including good dental hygiene, regular brushing and flossing, and dental checkups, individuals with chalky teeth can significantly reduce their risk of decay. Then we've got to look at dietary factors and dietary choices. A balanced diet, low in sugars, low in acid, high in calcium and minerals, can help strengthen and minimize decay. If you're getting lots of calcium and phosphate and magnesium in your diet, you're less likely to get cavities. You can also counter having chalky teeth by supplementing with vitamin D3 and vitamin K2, which are going to help you absorb more calcium from your diet and get it where it needs to be in your teeth and bones. Dentists can provide fluoride treatments. If you're looking for a holistic approach, I'm going to talk about some alternatives to that in a moment. Fluoride is scientifically, I don't like it. And with everything that's going on in the world at the moment where fluoride's a hot topic, I don't believe you actually need fluoride to have strong, healthy teeth. But you can have fluoride treatments at the dentist if you want. It's supposed to help, strengthen your enamel and protect against decay. And look, topically applied, I agree it does that, but I'm also concerned about the exposure to such a concentrated and large amount of fluoride all in one go. So there are remineralizing products that contain hydroxyapatite, calcium and phosphorus, and calcium carbonates and xylitol that can do the same thing naturally. Now, if your enamel is very chalky and pitted and it's worn, then we can place sealants and coverings onto the tooth to protect the chewing surfaces of the teeth, providing an extra layer of defense against decay. Now, do like, comment, subscribe, share the video at the end. I'll share some videos for you so you've got more information as well. Now, a bonus tip is you can use xylitol. Now, after you eat, anything that's got any sugar, carbohydrate, or anything acidic in, your bacteria in your mouth are going to utilize that to be their food source, and they produce acid, which then dissolves your tooth enamel and makes it porous, and that causes demineralization, and that's the first stage of tooth decay. Now, we can reharden that by using xylitol. So after you've eaten, you suck on a xylitol mint or chew some gum for about 2 or 3 minutes. Once you've done that, nothing to eat or drink, nothing, not even water, for about 20 or 30 minutes. And the xylitol helps stimulate saliva flow, bringing extra minerals that get incorporated into rehardening and replenishing the enamel. That's called remineralization. I'll share a video on that for you. But the xylitol also, when the bacteria eat it, it starves them of their food supply. They can't actually digest it and they die. Therefore, you get less plaque formation and less risk of tooth decay. If your teeth are very chalky and they're quite discolored and pitted, then there are some cosmetic things that we can do if you do have cosmetic concerns. This includes dental bonding or veneers, and this can improve the appearance of chalky teeth quite dramatically. Now, if your teeth are sensitive, then I would recommend using a desensitizing toothpaste. That can provide relief. Again, look for a natural one. They work really well, and I have done a video on that, so you can check that out. So let me know your experiences of having chalky teeth and what you've done to manage that. And in the meantime, check out this video over here on how to remineralize your teeth and prevent and cure tooth decay.